Welcome to Beyond Med AI, the podcast, where we bring you the top doctors leading the newest breakthroughs in medicine and research. My name is Shayan. Today, we're discussing a major breakthrough clinical trial that could redefine how we treat some of the most challenging autoimmune diseases. The study evaluates CAR T cell therapy as a potential treatment for severe autoimmune diseases. Involved in the study, we have Dr. Roberto Caricchio. Dr. Caricchio, thank you for your time. Do you mind maybe just giving us a brief background about who you are and what you do?
Sure. I'm a lupologist, or rather someone that primarily takes care of lupus patients and studies also lupus disease. And I've been doing that for quite some time. But I'm also the division chief of the rheumatology department at UMass Chan Medical School. And with that, it comes a variety of interesting responsibilities. But what I am at the core is really someone who wants to help, and and I don't think there is a better time today to help people, especially people with lupus.
Can you give us a little bit of an overview of this clinical trial?
The breakthrough came a few years ago. Not that many though, 3 years ago, from Germany. A colleague of mine decided to utilize an approach in leukemia and lymphoma, which was revolutionary, and actually was born also at the University of Pennsylvania in Pennsylvania, where I worked for a decade there. And it consisted to take the cells from the patient herself and instruct them, so to speak, to attack the cells in her own body that actually were inducing the disease, or B cells, so called. Of course, it took 20 years to get to the point in which technology was able to do that safely. And the first time that a lupus patient was treated with this modality was 3 years ago, 3.5 years ago. What this type of intervention, which is highly sophisticated, really set itself aside from anything else that has happened so far in lupus treatment and also other type of similar diseases in rheumatology, is the fact that after this treatment, patients are actually off therapy and with lupus completely in remission. Now that is why it's called a breakthrough, because there is no lupus after that. The treatment. Now, the treatment is not simple because it requires the patient to have the cells taken from them. It's called leukapheresis. It's a process that in oncology is common. And then those cells are engineered in a way that once given back to the patient, they attack the very cells or the very disease that is in the patient that is inducing damage. And with that, the disease actually melts away, so to speak. Now, we don't know if that is going to be permanent. The first few patients are 3-4 years out now, and still the vast majority does not have lupus to find, and they're off therapy. And then time will tell. But even though only a few years ago this technology was started, the amazing time is that there are already the second and third generation of similar approaches that are actually going to be even more available for more lupus patients.
Now, doctor, is this specifically for lupus or could this be for all autoimmune conditions?
So that's a very good question. No, it's not only for lupus. Was the first. But now there are clinical trials in almost every single systemic autoimmune disease. There are clinical trials in scleroderma, in Sjogren's, in mixed connective tissue disease, and I'm naming them all. And it's even beyond rheumatology. There are similar clinical trials in autoimmune diseases that affect the nervous system, such as multiple sclerosis and myasthenia gravis, and even clinical trials that are actually entering the space of inflammatory bowel disease as well. So it is really going into a number of other diseases, and even severe asthma or severe allergic diseases as well.
What have you seen as like the most common types of conditions that people are enrolling in this trial?
Yes. So Of course, being involved a lot in lupus treatment, we do participate for the most part in trials that have lupus patients as the objective for treatment. But we also do participate in clinical trials that involve patients with systemic sclerosis, which is so to speak, a cousin, a similar disease of lupus, still very systemic and very, very debilitating. For the most part, lupus is really at the forefront of clinical trials for enrollment in those clinical interventions, but also the rest of the autoimmune diseases are ramping up the effort. There are hundreds currently clinical trials either started or about to start with CAR T in a number of indications, such as lupus and others. So I would expect that in the next few years, all those diseases will be involved at the same rate. In fact, I mean, as I mentioned, what we are doing is the first generation of treatment of this modality called cell therapy, but there are already newer modalities and in many cases simpler interventions that though have a similar effect, although we don't have the same amount of data that we do have with the early one interventions. Our patients are now several years out from the treatment. And we still see outstanding effects, never really had before.
And when you say it's been 4 or 5 years with outstanding effects, have you seen consistency of the management of the condition, or have you seen diminishing effects over the couple of years?
Yeah. Well, in the majority of cases after this treatment, there hasn't been any really treatment because the patient has not required. We have seen some recurrence, so called. So very few patients did have the disease return, and we just treated as a normal therapy. Or in very rare cases, actually, they went through a similar intervention and had also similar effects. What I would say is that we are in a period of true experiments, true testing of those modalities. And in the next few years, we will know much more, providing that our patients continue to be so brave and generous in participating in those clinical trials. Without patients, we wouldn't have any advancement. We do need them. So there are so many different types of intervention right now that has stemmed from the first one, that we will have quite a different scenario in 5 years from now. And I personally predict that within 10 years, what we do today for lupus and other similar conditions is going to be very, very different. But in 10 years from now, we are going to be able to really treat at a much deeper and better level those very serious conditions.
Who would be the ideal candidate for someone to enroll in this clinical trial for severe autoimmune diseases for CAR T cell therapy?
Yes. So at the moment, the FDA allows for patients to have severe disease and also that has not responded to, or rather the medications have failed this patient, and this patient has not responded to conventional therapy. So there has to be the initial approach as so-called conventional. And then if the patient does not respond, the patient does not improve, then a CAR T would be appropriate. Generally, we looked at patients with organ involvement, such as the kidney or the lung, when it comes to scleroderma, for example. It's something that is measurable in terms of response, but it is for now for patients that are moderate to severe in terms of disease manifestations. Mild lupus patients are not appropriate for this trial because there are risks and it is a taxing procedure. Having said that, 10 years from now or 5 years from now, we will be able to actually provide this treatment or similar breakthrough treatments early on the disease. Because if you ask me which one is the ideal patient, Well, it's not the one that unfortunately did not improve after the first or second regimen, but rather is the one that has been just diagnosed, the one that doesn't have too much damage accumulated already, and the one that we can actually have the chance to really get rid or set into remission the disease as long as possible.
It's
For
exciting.
now, it's only the patients that have not improved after the first aggressive treatment.
Okay. Doctor, from your experience so far with this clinical trial, are there any patients that you were amazed of with the with the results or any kind of results that stood out to you so far?
Yes, I'm still amazed. I'm very amazed because I never done anything like this in which after treating the patient did not receive any further treatment for keeping lupus quiet. All these patients just go home. They are followed for a few weeks to make sure that no infection arises or that they are appropriately recovering from the treatment. But then they go on for their normal lives to their normal lives without treatment and apparently for now without lupus. And that is admittedly the most remarkable clinical and emotional experience I ever had by treating lupus patients.
Are there any risks or any unknowns that your team is still looking at right now?
Yes, that's an important question that needs to be answered. There are risks with this condition, with this treatment, as any other aggressive treatment. And the first one is the fact that there is a significant immunosuppression that within for the first few weeks or several months, that then the patient recovers. And for now, it has remained a risk. For the most part, some patients do get infections, but have been very manageable. And the other risk is during the intervention itself, the first few days, body undergoes, in some cases, an inflammation because it's reacting to these new cells that are given to the body. And sometimes they develop an adverse event that is called cytokine storm syndrome or cytokine release syndrome. And it's very typical for those interventions. Thanks to the oncology experience, we have mastered the way to control them. Having said that, I'm sure the patients don't feel good when they get it, so there is that risk. But the reassuring part is that we can take care of those. And for what concerns the long-term unknowns, well, they're unknowns, and it will take a long time to understand. But there might be down the road risks of other infections, and that only time will tell. That is why the FDA mandates 15 years of follow-up.
Doctor, I know you touched on this a little bit earlier, but just if you don't mind summing it up, what makes this potential treatment and clinical trial so unique?
Well, the fact that um, is is a living treatment, meaning that usually we give pills to people or infusions with proteins that help tame down the inflammation of the immune system that is inducing the disease itself. In this case, is actually an engineered living cell that is duplicated and given back to the patient. And this living cell is search and destroying the very disease that is affecting the patient. So that is very unique. It is unique to all the cellular therapies that are undergoing currently. And the idea that there is something newly engineered that helps the patient with her own cells to tackle the disease, that is quite remarkable. And if I think all the other treatments that we are using, they really pale in terms of technology. And on top of that, I would continue to remark that this is just the beginning. So this is the first one, and possibly the second, but there will be many more coming forward. Although we need to learn step by step, and that reassures though that the future for those diseases is finally quite bright in terms of controlling them.
Doctor, I know you're talking about the various steps in the future. Now, What do you see as the actual next step of this study?
The next step, I would say that uh, um, there are two next steps. The first next step is to make sure that the treatment is safe, and the more time goes by, the more these individuals that underwent this treatment are fine, the more we feel confident that actually safe. We do have the data from tens of thousands of people with lymphoma and leukemia that have been treated so far. So we do have that part. But those patients are different than lupus patients. So they might be more severe in terms of long term because of what they come from. So time will tell, but we need to establish that one. The second step is to make sure that the newer technologies are proven as efficacious as the first one, because they might not need the leukapheresis, this important step that needs to happen before infusing those extraordinary cells. And they might not need to be admitted to the hospital for a few days to receive this treatment, but it might be much easier, and it could be just a simple subcutaneous injection. So the next step is to make sure that this progress is applied to lupus patients, and then lupus patients and patients with other systemic and severe autoimmune diseases will have access to the old one and to the new one. So to make sure that the progress continues. But one more thing that I have to say is that the treatment that we are doing now is the proof of the concept that the way that we will treat those diseases in the future and right now is going to be very different than from the past.
So in the future, I mean, how soon, if everything works out, how soon could something like this be widely accessible for autoimmune conditions?
Well, I would say within the next 5 years. And that is not an overly optimistic time. I think that we might have sooner, actually, the first approved, but we also might have much sooner the newer treatments that would extend to patients that have less severe disease. Because for now, it's only these patients that have very severe. But the easier is the treatment, the less involving, the more patients will have the possibility to have access to.
Doctor, thank you so much for your time. Before we finish up, are there any final or finishing words that you have?
Well, yes, I think uh, self-advocacy is very important. So patients, inform the patients are already half treated. So if patients think that they are not responding to the treatment and they see that there is damage from the disease, they should ask their doctors, is there anything new that we can have access to, because there is a significant number of clinical trials that are undergoing in the United States and throughout the world that patients might not know about it. And if they ask their rheumatologist, then they might be informed.
Dr. Caricchio, those are some great words. Very grateful for your time. Thank you for being part of the podcast.
No, thank you for reaching out, and Happy New Year. And I wish everyone a healthy New Year.